Hello, cosmonauts! Today we are going to be exploring what Reddit asked doctors. What is the scariest thing a patient has ever done or said? Answer 1, Doc. I can't wait to have this baby. We'll finally have our baby girl. Now we can stop trying. When I was doing my final year of hospital rotations, I got called into one of the OB ultrasound rooms by the attending. I was just about to leave since my shift had just ended, but decided to see the one last patient since we had such a good shift and I didn't mind making another patient's day. The attending points to the ultrasound and asks if I can see the heartbeat. I thought she was just quizzing me since I was a med student, and I was internally panicking since I couldn't see it. I apologized for what I assumed was my lack of knowledge. Turns out, I was called in to confirm lack of heartbeat on this 8-month-old baby in utero. They needed 2 doctors to confirm. I never wanted to be more wrong my whole life. When I was left alone with the patient, she kept trying to convince herself that she was okay and that she had 3 other children to come home to. But you could tell how devastated she was. Then she said, I guess I was right. This was going to be my last baby. And then just walked out. I was on call the next day and ended up seeing her through pre-op, the delivery, and post-op. She's one of the patients I will never forget. Answer 2. I've got one. I'm a psychiatrist with a distinct and relatively rare appearance. Because of this, I've spent my whole life hearing that I look like anyone with a vaguely similar skin tone or hair color, even when I didn't see the resemblance. Fast forward to my intern year. A patient comes into the emergency department after being found severely hypothermic, so much so that he was initially pronounced dead. Miraculously, he was resuscitated, but his identity was unknown. And as he began recovering, he started displaying signs of psychosis. That's when the primary team called in a psych consult and I went to assess him. The moment I stepped into his room, I was taken aback. The man lying in the bed was a spitting image of me, except he looked like an alternate version of myself, one who had gone down a much darker path. His face was weathered, likely from drug use and homelessness, but the resemblance was unsettling. As I tried to gather details about his identity and psychiatric history, he locked eyes with me, his stare intense and unshakable, and said, I am you. That became his only response whenever he spoke to me. For 3 days, every time I interacted with him, all he would say was, I am you. Being a sleep-deprived intern, this messed with my head more than I'd like to admit. Seeing someone who looked eerily like me, who had literally been pronounced dead days earlier, repeating that phrase over and over, it freaked me out to say the least. After a few more days, and as he started coming down from meth-induced psychosis, I finally got through to him. I explained that he couldn't be released as a John Doe, and that we needed his identification. Eventually, he gave me his social security number. When we ran it, we discovered he had multiple out-of-state warrants. The whole experience shook me, and I definitely lost some sleep over it. Even now, it still sticks with me. Answer 3. I'm not a doctor, but a nurse. This happened when I was still a CNA. Young women brought into the ER for behavioral issues. Family says she hasn't slept in weeks. She's weirdly quiet for a while, then starts biting herself on the wrist. We get violent restraints and she goes ballistic. Like possession screaming, no words, just growling and agony. Well, this goes on for a while and she calms back down again. Even weirder negative for everything except CT. All of a sudden, the sitter screams, she got out! This lady ripped off violent restraints, pulling at her skin until it bleed. She immediately starts slamming her head into the ground. RN pulls her up and gets a Sparta kick to the chest, and he falls backward through the door. Tall dude. I get scratched, the doctor gets punched, and the security gets it bit. Doctor knocks her out with a shot of the good stuff. We assume she's out for a while, so we breathe while we start the paperwork for injuries, but not even 5 minutes later, she wakes back up and starts screaming again. She does this all night, and she's too messed up to go to behavioral, so until she's stable, she's inpatient. Longest night of my life. Come in tomorrow. She's still there. She's too violent to go up to a unit, even if there was room, COVID times, and they still have no idea what's actually wrong with her beyond not sleeping, psychosis, and generally wasting away. After a few days of screaming and violence, she just goes glass-eyed. We get a feeding tube, but she just keeps wasting, and after 9 days dies. I took 8 months for our pathologist to figure out what she had. It was a rare prion disorder that can happen in an astronomically small percentage of synthetic opioid users can sometimes get. This is the closest thing I've ever seen to possession. Answer 4. Not a doctor, but a nurse. Once a psychotic schizophrenic patient got me, and it was because of how normal she said it. Screaming, threatening to kill me, and then sitting on the commode, and then calmly looking at me and says in the most normal and monotone voice, I'm sorry, I know I'm not well and being mean to you. I'm in hell, and I don't know how to get out. I will never forget that, or how it made me feel. It's like she had a 10-second lapse of her manic episode to apologize and tell me how she felt. Made me super empathetic to my psych patients. Answer 5. Not a doctor or a nurse. One of my uncles had stage 4 pancreatic cancer. He was a tough guy and didn't trust hospitals, so he didn't see a doctor until it was way too late, despite being in debilitating pain. When he did, The prognosis was grim. He had maybe 6 weeks left, and pancreatic cancer is a painful way to die. He decided to get MA'd instead, medical assistance in dying, which is legal in Canada. On the day we were all gathered around his bed, all the paperwork and permissions were sorted out, and the syringe of drugs was connected to his IV. He was heavily sedated, but he has to be the one to push the plunger, which he did with the help of his wife. He closed his eyes and his breathing got very shallow and slowed down. After a few minutes, we thought he had passed. We were all standing around him, some saying goodbye. A lot of people were crying. About 10 minutes passed and people started to leave when, suddenly, in a strong, clear voice, he said, "Russell, wait for me." Then he was gone. Nobody knew who Russell was, and it was kind of a mystery we talked about from time to time. Years later, his wife passed, and when his kids were going through her things, they found a very old photograph of him when he was maybe 5 years old. He was in a sandbox with a small dog. On the back of the picture in faded ink it read, "Russell, 1944. The thought that our pets that have gone before us meet us to help us cross over fills me with comfort. I hope it isn't just a mind trying to make sense of a crazy time." Answer 6. My great-grandma was a hospice volunteer. I've told this story in this thread already, but I want you to hear it too. And she had so many clients that would be visited by loved ones from their lives that had passed away. So many that she believed it wholeheartedly. She was fascinated with death, in a way. Her time came this January, and her son told me she had been hallucinating cats and dogs and people that weren't alive anymore. I don't think she was hallucinating. I think that if you die a natural death, you're going to be visited, and you're going to want nothing more than to go with. One of the clients while I was living with her was all, "Oh, everyone's here, so I guess I have to go now." All cheery as a person in a cheese shop. And then she did it. She closed her eyes and she was gone. Grandma went with her people too, and I'm hoping that when I go, at least my dog will be there. He tends to scream when he hasn't seen me in a while. Answer 7. Talking about unexplained phenomena, my mom worked as a nurse and told me this story. She was checking on patients, small-town hospital, nothing out of the ordinary, when out of the window in a garden right outside that room, her aunt was waving at her. My mom waved back, kept checking on patients. She looked out the window again and her aunt was nowhere to be seen. She didn't think much about it and kept working. She went to her mother's house after her shift and everyone was crying. It turns out that her aunt had been hospitalized in that same hospital that day, and she died around the time my mom saw her in the garden. Her aunt had come to say goodbye. Answer 8. Not really a patient who said it. I was on a trauma shift, trauma surgeon, and got called in for a bad car accident. When I got there, they were doing CPR, and eventually we got her back, stable enough for a CT. Another trauma comes in during all this. Turns out to be the husband of the trauma patient. My PA went to go survey the new patient. She came back white as a ghost. Names changed. John just came in next door as the new trauma. I think that's Emily. I looked at our patient who we just did CPR on and almost fainted. I don't recognize her until I smelled her perfume. She was so banged up she didn't look like herself. I almost threw up. Emily was another PA on our trauma team. She ended up passing a few days later from severe brain injury. I think that's Emily will be forever burned on my brain, and among the top 3 reasons I don't do trauma surgery anymore. Answer 9. Not a doctor or a nurse, but a former army medic. On a foot patrol in Baghdad, had a guy hit by an IED. Guy was conscious and laying on the ground, missing one leg and most of the other below the knees. Some of the guys were trying to get TQs and ETBs going, but this guy, in shock, just kept asking for a cigarette. I was working his lower extremities and was afraid I was going to completely remove what was left of his remaining but barely attached foot by accident, and he kept fishing in his shredded cargo pockets for his pack of smokes. Obviously, he was dipping into shock, but he just kept asking for a cigarette. "I need my smokes. Doc, just let me go out with a cig." One of his buddies slipped one while we got his legs packed and started movement for evac. I reckon this seems tame compared to a lot of other stuff, but it's hard not to associate the smell or mention of cigarettes with this guy. Dude made it out alive. It was just seriously jarring for me that this guy was absolutely fixated on getting a cig when his legs were toast. Hey you, if you enjoying the video, subscribe for more histories. Answer 10th first month as an intern. At this point, I know everything to crush med tests, but nothing to handle a patient. Only doctor, covering the night shift at a VA, code green, which at this location means a patient is hostile. Jog around a corner. Find Mr. S, who I admitted a few hours earlier, now sundowning and holding a piece of broken glass in front of him like a knife. Sundowning is when an elderly, maybe demented, patient has increased confusion, orcasors, agitation early in the night, especially in an unfamiliar setting, which every hospital is. He's holding the broken glass towards the charge nurses and screaming nonsense, mainly F-bombs, and wanting to go home. Me too, man. 2 police officers are standing a couple yards in front, one touching his sidearm. Nurses and techs are lining the hallway. Lights are on, TVs are on. Mr. S is not enjoying his stay. Everyone looks at me. The youngest, least experienced. Why not? So, what do you do? First thing, greet Mr. S. I admitted him, so I knew he was a good guy in a confused state. I never mentioned the situation, just started random polite conversation. Next, motion for the cops to leave, the extra nurses and techs to leave, turn off the TVs, turn off the overhead music, turn off some lights, de-escalate everything. And then, with just the charge nurses and I in the hallway, minimal stimulation, we waited him out. Eventually, he forgot about what he was holding, as we talked about his wife and fishing outside the city. We did end up giving him a sedative once the danger passed. Not sure if I should have, and the next day we got him home. Answer 11. Had a similar situation, but less intense. A few years ago, at an assisted living I worked at, got a call late on PM shift from the other building. The two workers were trapped in the nurses' station because the building's wanderer with dementia. Mr. Jack decided he absolutely hated their guts and wanted to beat the shit out of them. I responded and ran over. I'd seen the man once or twice, but never worked with him. Thankfully, he was pretty short and wiry, but was known as extremely combative. I walked up to him, and in the seconds before he realized I was one of them, I greeted him with a smile, a handshake, and a "Jack, how the hell are you?" In his momentary confusion, I ushered him away from the door a bit and asked him, "What the hell are those girls up to now?" He started piping off about how they're all crazy and how he's just trying to get home. I lead him away from the door, managed to sit with him on the couch and talked phone numbers so I could call him a ride. This man was very confused at this point in his life, which was my only saving grace. I was able to leave a few minutes after that with no further incident. Answer 12. I had a patient in my ICU who wasn't unknown to us. She first came to us, then went to a skilled nursing facility where she'd get sick, come back to my ICU, get better enough to go back to her SNF, a few months later get sick and come back to us. Rinse and repeat. I want to be very clear, it was not at any fault of the SNF, skilled nursing facility, long-term acute care facility. It was her disease process and was expected and unavoidable. And one day, she's my patient and the doctor has already arranged her discharge back to the SNF again. She's decently with it, a little pleasantly confused, but still can tell me where she is, why she's here, what year it is, all the things, but still gets a little confused. I'm chatting with her and she says, "I'm going home today." And I clarify that she isn't going to her house, she's going back to the SNF, and she waves me off and says, "No, I'm going home, not back there, I'm going home." Her family comes in and it's the same convo. They're trying to make her understand that she isn't going back to her house, and she's like, "Yeah, I'm not going to my house, I'm going home." Strangers walking past her room, she'd wave them down and joyfully tell them she was going home today, come say goodbye, and give me a hug. I'm going home. And in the middle of me trying to explain again that I'm not sending her to her house, but to her SNF. Transport is on the way to come take her back to the SNF. And that's why I'm packing up her things. Her eyes just roll back into her head and she goes asystole. She straight up died on me. I should have known she was devoutly Christian, and growing up in the church, dying was often referred to as being called home. I should have caught that nuance. She was serious. She went home. She knew and was trying to tell us, but she wasn't scared. She was happy telling everyone and saying her goodbyes, even to strangers. She was done and made her exit. Answer 13. When I was a CNA working hospice, I got called to go assist a nurse who was assisting a rather volatile patient. The woman was an alcoholic and chronic smoker who got lung cancer while fighting renal and liver failure. She had had a close call recently while in the hospital and coded very briefly. After that, she was very adamant that no man be let into her room. When I got there, the nurse gave me a heads up that it wasn't just any man she didn't want in her room. It was a particular one, and nobody could figure out who it was. Her son hadn't spoken to her in a decade or more, with the exception of one visit before her close call in the hospital. BC of her sexual, mental, and physical abuse. Her father was long gone. She had no brothers or uncles, and her husband had died tragically a couple decades earlier. And yet she kept insisting we not let him in. She developed the telltale death rattle. And so we waited. The room went still, and the nurse and I looked to each other, knowing that she had just taken her last breath when suddenly she sat up and started screaming, "He's here! You've let him in! He's here!" Her eyes were wide, her skin pale, and she trembled all over, staring intently at the corner of the ceiling. We tried to assure her no one was there, but she just whispered, "He knows. He's smiling. 'Cause he knows," as we got her to lie back down. She closed her eyes and within minutes gave one last rattling breath and was gone. I worked with that nurse again a few months later, and she told me that when she called the son to inform him his mother had passed, he told her that he'd told his mother the last time they spoke that he'd prayed the devil would come and take her since she'd spent her last exchange with him, trying to use God to shame him into caring for her in her old age. So whether the woman was hallucinating her fear or was actually seeing something sinister coming for her, IDK. But the nurse seemed to think it was really the devil. She swore she was going to go back to work in a hospital, said she'd seen enough end-of-life care. Answer 14. I'm a psychiatrist. The scariest patient encounter of my career was during training. I was rotating at the county hospital with the sickest, most acute psychiatry patients. One morning during rounds, a very psychotic patient got extremely agitated, and I watched in horror as he punched open the plexiglass window of the nurse's station. He was going after one of my colleagues. I quickly directed the med students to safety and joined my colleagues and the nurses to contain the situation. This patient brutally beat the shit out of one of the cops that rushed to our aid, and then he proceeded to break open the doors to the psych unit. It became an all-hands-on-deck situation, and eventually we were able to restrain him. I had never seen so much fear in the eyes of the nurses before, and these are seasoned nurses that have dealt with plenty of psychotic patients who would get aggressive from time to time. Sad most scary encounter. I was on call one night at the same unit. A tall, bulky male patient was requesting to leave AMA after midnight. He was psychotic and unsafe to leave. He said some things that didn't make sense, but I saw that twinkle in his eyes that he was hallucinating while talking to me. I swiftly backed away and escaped into the nurse's station. A second later, I realized that I had narrowly escaped being assaulted. He was banging aggressively on the nurse's station plexiglass, yelling, "Answer 15, doctor here." First one that sticks to mind isn't so much what the patient said, but more her body language that clued into what was going wrong. Story. I was a medical student at the time, and the city my school was in is a hub for human trafficking. I noticed a patient in the ER who had a pretty bad injury to her face was with a sketchy-looking guy who was not related to her. She wasn't my patient, but I brought my gut feeling up to her doctor, who then made up some excuse to talk to the patient alone and got her to help. Turns out she was a victim of human trafficking. I never talked to her myself, but I couldn't shake the vibe I got from looking at her and the man she was with. Answer 16. Probably not what you were asking, but the thing that I've been most scared to respond to was a 7-year-old-ish girl stopping me talking to her mom, and first asking me if I was a doctor, which I responded yes to, and then asking me very frankly if her dad was going to die. Given that he was intubated on 2 pressors with a multi-drug-resistant infection on top of a hematological malignancy, the real answer was most likely. Striking a balance between remaining honest and not adding extra trauma to her experience, knowing it could possibly be something she carries with her for her entire life, without preparation. I was on a consulting team, not the primary team, so wasn't on the team designated to discuss goals of care and overall expectations, was terrifying. So I told her that I didn't know, and her dad was very, very sick, and it might take us a long time to know what would happen. But a whole team of doctors and nurses were going to keep trying their best to help him get better. He died several days later. Answer 17. Not a DR, but at age 18 I went to Haiti to help with the hurricane crisis that happened. About 6 months after the relief effort started, we ran a pop-up clinic for people in need of medical care for about 3 weeks. A patient came in. He was the same age as me. He was on crutches and appeared to have a large shard of dry wood stuck in his shin, which looked green and infected. The doctors set to work removing the wood, only to find out that it was exposed bone from a brutal fracture that had occurred 6 to 8 months prior. How he survived, I had no idea. I could only speak limited Creole, but he told me how much pain he had been in and how he just wanted to run and play kickball with his friends again. I hope you're well, Dante. I still think of you. Answer 18. I was a very new intern, working in the ED. I got asked to see a young woman patient, and the diagnosis put beside her name by triage staff said, self-harm. So I took her into a consult room and tried my best to ask her about what was happening. She said to me, "I think someone was in my room last night." And I was like, that's a weird way to start to talk about self-harm, but I answered, "Oh, okay, why do you say that?" And she lifted up her shirt to show me the words, "Help me," carved into her abdomen. The cuts individually were very thin, made by a razor blade, but each letter had been gone over many times, so they were deep and quite fresh. Still bleeding. I looked up at her horrified, and she said, "I don't know who, but someone must have done this to me while I was asleep because I don't remember doing it to myself." The psychiatrist she saw after me thought the patient might have had dissociative amnesia, but I'm not sure what happened after that. That was like 20 years ago, and I can still feel the unease of that encounter. Hey you! Subscribe for more histories. Answer 19 nurse here. Had a patient going through opioid withdrawal, asked if I could give him an injection of a certain blood thinner. He said yes. He didn't like that the injection hurt. He leapt out of bed, backed me into a corner and threatened to smash in my skull. He reiterated he once killed a police officer by beating him to death, and he wanted to do the same to me. He was 6 feet 2 inches. I am 5 feet 0 inches. I managed to de-escalate the best I could, gave him his opioids, encouraged him to go for a walk-off unit to let off some steam. It worked, but before he walked off unit, he told our charge nurse he was going to kill me. Management, security, and the doctor did fuck all. Had to spend the next few shifts worried I was about to get my ass beat. Answer 20. Again, nurse here. Plenty of times I have had patients with psychosis tell me they see a person in their room. This is never scary to me. I don't attend to where their vision is because it makes the hallucination more real to them. I just do a full assessment, figure out if they hear voices, if the voices are telling them to harm themselves or others, encourage them to engage in distractions, talk to them if that's what they need at the moment, and give them whatever meds necessary. Freaks out other nurses, though. Have had many dying patients say they see family members or angels in the room. The patients in those instances never seem scared, more like comforted. I actually encourage them to focus on those family members that they see if it brings them comfort. They usually pass shortly afterwards. Answer 21. I work as an ER nurse. When I was starting off in a rural ER, we had a Hmong lady come in and said she fell. Her ear was missing and there was a clear human bite mark to her cheek. She refused to tell the actual story. She came in with some friends that seemed equally shocked, and I pulled them aside and confronted them. Who bit this woman? He said, a cat. And before I can stop myself, I said, what, like a fucking tiger? And he pretty much went into his shell. She did not open up to the cops. She was flown to a hospital with plastics, and as luck would have it, I knew the nurse that took care of her over there. The plastic surgeons also asked, and still no answer. I've always thought it was a scorned lover in an insular community and they covered for them. It really hit me on the drive home at 3 a.m., driving through this tiny town knowing this guy was out there. Answer 22. During the first year of my psych residency, I came across this patient 19/M. He struggled with depression and was admitted in my ward a couple of times. Post that he started coming for regular follow-ups and was doing well. One fine day, he came to the ward to meet us and gave us sweets and thanked us for everything. It was a very proud moment for me, as he was one of my first patients in the field of psychiatry. The same night, I was on call, and at about 3 a.m., I went up to the main entrance to collect my food parcel. I saw a car going towards ER and legs were sticking out of it. I felt like I recognized those pants, so I walked up to the ER to see who it could be. He had hung himself that night. Nobody suspected it. Not his family, not us. Still haunts me at times. Answer 23. Not a doctor, but had a nurse nearly beaten to death in a hospital I used to work in. The patient was known to be violent, but they didn't take any preventative measures. A nurse went into the room to give the patient meds, and the patient jumped on her and was repeatedly smashing her head into the floor. One of the other staff members heard a scream and thought he had killed her with the amount of blood everywhere. She ran in and kicked him in the head as hard as she could and dragged the unconscious nurse out of the room. I can't remember what happened after, but she survived with permanent damage. Answer 24. One of the scariest things I've heard as a doctor came from a patient who calmly said, I see the man in the corner again. There was no one there. The patient was fully alert and oriented, but their vitals were crashing fast. Moments later, they coded. Another eerie moment was a patient who came in after a traumatic accident. Right before surgery, they grabbed my wrist and said, don't let me die, doc. Their vitals were stable. But despite our best efforts, they didn't make it through the operation. The things patients say, especially in their final moments, can stick with you forever. Some Womisner. My great-grandmother started talking to the air and said that Uncle Bill had come to visit her. Uncle Bill died in 1999. When my grandfather died, my mom was with him. He was on hospice, but fully alert and oriented up to this point. Mom heard a knock on the door, went to check it, nobody was there. When she returned to my grandpa's bedside, he said, my dad and I are going for a walk. Then he closed his eyes and passed peacefully. Edit to add. My other grandfather, who was in a care facility due to rapidly progressing dementia and Alzheimer's, didn't remember my family's names when we would visit, but remembered how much he loved us. Before he passed, he started talking about how his dad was saying how he was proud of the family grandpa raised. He also began talking to an empty part of the room, saying, Craig, I've missed you so much. You wouldn't believe the time I've had. My Uncle Craig died at 18. Long before I was born. It's reassuring to hope that someone I love will greet me at death's door. Thank you all to those who have shared similar stories. I try to keep myself busy, as all but one of my grandparents passed within the past year, and I'm not really sure how to navigate grief, but reading your stories has been really sweet, and I'm grateful for these comments and the many memories they remind me of. Wishing the best to all those who have lost someone. Answer 25. Upon DC with refusal of narcotic medication in the hall being escorted out by security, she looked the doctor in the face and said, "I've been working on finding out where you live, Dr. Ashuain, so I can kill you and your family." It was one time I actually felt scared. She was charged with phone harassment for calling for this doctor hundreds of times and making threats. She also broke an older nurse's humerus by jail, slamming her to the ground in triage in front of her kids. Also known to threaten racist and targeted verbal and physical attacks in the community that was documented in local news. Answer 26. I'm not a doctor, but I'm pretty sure I gave an MD the fright of his life. When I was around 10, a buddy threw a snowball at me and caught me right in the eye. I say snowball, but really it was more a jagged ice rock gently glazed with snow. I won't go into specifics, but I did need to go to the hospital as the injury was pretty gruesome. Fortunately, it looked worse than it was, and I ended up no worse for the wear. But there was a lot of blood, and the doctors were concerned about damage to the retina. It was also the height of flu season, so as I'm being wheeled through the hospital corridors, all I can see when I raised my head were people sitting on the floor with their backs against the walls. It was like a pre-apocalypse scene from a Stephen King novel. The nurse who was walking me through the hospital told me to keep my eyes closed, and every time I raised my head to look around, he promptly put his hand on my forehead and pushed it down. I cannot stress how ingrained it was that I had to keep my eyes closed. As the hospital was packed, they had no place to put me. So the nurse put me in a storage room. You know, the place they keep routine medical supplies like bandages and tape, barely bigger than a broom closet. He then tells my brother, who was the one who took me to the hospital, that now would be a good time to get coffee. So they both leave this 10-year-old kid who is at this point convinced he will go blind if he opens his eyes alone, in what is essentially a closet, alone. Oh, and nurse dude turns off the light when he leaves. After a few tense moments of my body seemingly trying to decide if it wanted to pee on the hospital gurney, puke on it, or poop on it, or an unholy combination of all three, I hear the door open. The light switches on and there is a brief moment of silence, which I presume was the person quickly noticing a 6-foot gurney in a 6-foot and 1-inch room. And then I hear this person rummaging through the various supply bins around me. Again, I can't stress how ingrained it was in me that I was not allowed to open my eyes at the risk of total blindness. I literally willed every muscle to be as tight as possible. And then the person in the room dropped something on me, and I flinched, which is a reasonable reaction, I thought. The person in the room with me disagreed as he screamed at the top of his lungs and ran out. At no point did I open my eyes. My brother came in a few moments later, laughing hysterically. Turns out the room I was in was also a place they stored the dead bodies of people who didn't survive past ER while waiting for someone from the dead people storing department to retrieve them. The dude who popped in was a doctor just getting medical supplies and presumed I was a cadaver. So when I moved, it gave him the shock of his life. Oh, how I laughed and laughed. Well, I mean, years later, I was able to laugh about it. That specific moment when I realized I was in dead dude storage, my body decided what it wanted to do on the gurney. I'll spare you the details, as it was almost as traumatic as the eye injury itself. Answer 27. Nurse, not a doctor. Work on a pediatric cardiac ICU where shit tends to hit the fan with little to no warning. Kids can compensate beautifully until they decide to simply die. Had a 3-year-old patient come in with a heart rate in the 200s and 10s, and nothing we did brought her heart rate back into an acceptable range. We'd deliver meds, her HR would normalize, then she'd flip back into SVT/tachycardia. She kept drifting off to slip, then jerking awake suddenly and screaming, clearly terrified, then would fight to stay awake until she nearly passed out from fatigue. This cycle repeated itself over and over. I had a terrible feeling about this patient and elevated my concerns to the team, so we weren't completely unprepared for what happened. Close to change of shift, she sat up from a dead sleep, screamed, then collapsed. No pulse, not breathing, crashed to ECMO. Another 3 or 4-month-old patient was fussy as soon as I started my shift one morning, intractably crying, in and out of atrial tachycardia, which had previously been managed with meds, but otherwise doing well clinically. He'd had an IV leak, a small amount of irritating fluid into the skin of his arm overnight, so I asked for a dose of pain medicine to make sure he wasn't experiencing untreated pain. No change, still screaming. I had 2 patients that day and remember going into the other patient's room and giving meds, doing my checks and assessment as early as I could, and warning the parent at the bedside that I might be getting busy next door. Just a gut feeling. Sure enough, as I'm finishing giving my happy, stable patient his meds, I look over and my other patient's oxygen sats have dropped to the 60s. Go over, throw oxygen on him, call a provider, and when I listen with a stethoscope, I realize that he's lost the blood flow to his lungs, nearly crashed to ECMO, managed to emergently intubate him and get him to the cath lab to stent prop open structures to get blood to his lungs, and he discharged from the hospital a week later with no residual effects. Panicky babies make me feel panicky. Answer 28. Not a medical professional, but I remember a conversation I had with my grandmother when one of her sisters had passed. Grandma said she was on the phone with her, and my great aunt starting talking like their late father was there in the room with her. That's when Grandma knew it wouldn't be long. My great aunt passed a few days later. Then Grandma looked me directly in the eye and told me, "That's how you'll know when it's my time. If I ever start talking to your grandfather or your late Aunt Margaret, you'll know I'm about to pass." 20 years later, I had moved out of town and was talking to my mother. Grandma had gotten to the point where she needed to stay with someone and was living with one of my mother's sisters. Mom called me to tell me that Grandma had been admitted to a nursing home that night as she was starting to hallucinate. She was having a full-on conversation with not only her late husband, but several other relatives who had passed. I felt a chill and said, "Mom, it's her time. She won't make it through the night." Time of death. The exact moment I felt that chill. Answer 29 nurse here. The amount of abuse we put up with is astonishing, but I'll list a couple. Patient who was with us already a few days, was fully alert and oriented, groped the ass of one of our nurses. Not like oops, my bad, like clearly intentional grabbing and getting a good feel. Nurse obviously was not happy about this, escalated to charge nurse and house supervisor. Police were called. They didn't bother coming in, probably because they didn't feel like making an arrest and having to keep a deputy watching him until discharge. When confronted about the incident by charge and supervisor, patient stated, "If I see that nurse again, I will fucking kill her. I don't care, I'm already on parole." Another patient, under my care, admitted to us from ER, overdosed, suspected to be intentional on his part. Patient was restrained when I got him. Story was he would wax and wane. When he was in ER, he was practically comatose. He woke up, immediately stood up and proceeded to pin the nurse to the wall and strangle her. It took 2 nurses and a tech to rip him off of her, and then 5 security guards to get him in the bed restrained. Had to renew the order for restraints that night, and doc asked if I want to trial off restraints. Normally I would, because patient rights and all, but he had a sitter who was a 20-year-old tiny 5-foot girl, because psych hold, politely said, not really wanting to try, he strangled a nurse for which he has a warrant for. Don't feel like walking into a dead sitter. He broke the restraints at least once that night. Another. Patient in ICU, family obviously stressed. One in particular was upset with the whole care team. Not sure the details as to why. Got heated with the nurse. The nurse left the room to get something, and when they came back, there was a loaded pistol on the table next to that family member. Police called, family banned from visiting. Now every visitor gets their bag searched and goes through a metal detector. Answer 30. Scariest thing a patient has done. I had a notoriously violent inmate slip out of the cuffs in the ED room and start beating the shit out of the CO with him. I'm a pretty big dude, so I go running in to help, and it's like me and this cop trying to get this dude under control for what felt like an hour. Punches, kicks, chokes. It was a full-blown street fight with this guy trying to grab the CO's gun. I honestly thought one of us was going to die or get seriously injured. Tried to press charges, went to court, and was told by the judge that this was accepted as part of my job. And that was my first foray into NYS bail reform and the fact that nobody in the criminal justice system has our backs. Really changed my view on this county and my state. Only time I've ever actually had to punch a patient in self-defense. Although I've got combative patient stories for days like we all do. Sketchiest? I had a PGY3 resident and she goes in to see a patient for a CC of penile problem. Dude pulls his penis out and shoots a load right on this female resident's hand. How this dude had such control over that, I will never know. Then, throws the entire jug or urine at bedside onto the nurse and elopes. Tried again to press charges. BC, it's literally sexual assault. And again, we're told no because he's a psych patient. This is life in the ED, folks.
That was enough for today, Cosmonaut. I'll wait for you in the next travel.